All right, thank you so much for the very appreciative introduction and your friendship. Love to be in Sedona, and of course, hopefully we have, it's been so far a great meeting. I'm typically talking about, GI colorectal cancer updates, which is what I did like 2 weeks ago in Philadelphia, but today is gonna be much different, and this was a presentation that I did it, like from the beginning because of, Sarah's vision, right? So I never was used to talk about myself. I think it's kind of, interesting. So we're not used to that as physicians. We always want to talk about the patient, talk about the things that others folks are interested. So I'm not going to talk about myself too much here, but I wanted to share is mostly what I have learned as I move out of my comfort zone from being an oncologist in an academic practice to going to more like a hybrid startup situation, and going through different, hoops and bounds and managing that along with, being a spouse and being a father, all that wanted to come together and kind of give a perspective that was helpful for hopefully most of us from a perspective of the meeting, which is renew and review. And for us, that's, to me, is like, what are the powers that we can develop from those experiences? So that's what I wanted to talk about today. So the title is super long, I get it. So, so I'm currently the medical director of Oncology Research at Capitol Health. I'm also on Twitter. So happy to engage beyond, after, and also throughout the meeting. So my disclosures are there. So TLDR, so too long don't read, what is this all about, right? So first of all, talk a little bit about me beyond what you see on Twitter, on LinkedIn. I'm very active there, but I'm always very opinionated and saying random stuff, but more about like what is, who is Arturo and what is it all about. A little bit about MSEd, which is a company I helped co-found it, and why and how I made the choices that made me move from academia to a startup kind of biotech entrepreneurship. The learnings and what we call powers acquire along the way. That is not only my power, it's a power that all of us can harness, and hopefully we can learn and optimize them together. And then ask me anything. I don't think we'll be able to get it with the time allotted, but I think after we get some good time today, I think we have hiking later today, so we can do that on the top. So far, just on the medical side, this is the only part you're gonna, hear about me. So 23-year-olds so far working as a physician. I've been in multiple places. So I was initially in Colombia at the university there, the National University. Then I moved to Baltimore. Then I went to work at the NIH. Then I went to University of Miami. Then I went to Penn. And then I started learning about entrepreneurship and AI and all that stuff at MIT. So those are all the things I do together. And probably what I've seen online, on Twitter, on LinkedIn, is all these random things that you get, the publications and the awards and all that. To me, that's really superfluous, but it's part of what we do as physicians, humans, and others. So, but this is what started everything. So this is me and my mom. So this is when I was, I guess, 1 year old. In sunny Bogota, Colombia, which is always the same weather because it's at the equator level. And I had a wonderful time there when I was a kid, but it was also hard because my mom was the one who took care of me as a child. So that taught me a lot of the things that I wanted to develop as an adult. The ability to, be grateful about things I had, but also the grit to overcome any challenges because that's what you care about to thrive in life. So the first power that I think I harnessed during that journey is the power of friendship. So here you can see, there's very young people here. Who are those? Like I'm, in the middle with the sunglasses there. So I was 16 years old. That's when I started medical school. I have no idea what I was doing. I didn't even know, how meaningful it was for me to see a patient or how, happy it was going to be for me to tell someone that their cancer was in remission, something like that, right? So all those friends really helped me along the way to become who I am now. So that's why I have a slide for them. So they're all very successful on their own. Interestingly, many of them in academia. So so Catalina, she is a very successul plastic surgeon. Carlos, I brought him to the United States. He didn't want to come. And I said, you're so smart here. You have to be here. You're going to do great in the United States. And he is now. He's at Brigham and Women, actually now as associate professor at Harvard and thriving. My friend Mauricio, he is another example of really profound grit and coming from basically poverty. Now he's a neuroscientist, right? So, and my friend Angela, she's a pediatric endocrinologist, and my friend Gabriel Tinoco, who's an oncologist too. We trained together since we actually met since we were 4 years old in the same school. So all of them, now very successful. So the power of friendship, I think, is something that we all should harness on our journeys. The power of motivation. So this is the reason why I became a hematologist oncologist. So this is my brother who passed away from leukemia. That was at a time when he was diagnosed, when I was just going into my journey of internal medicine, kind of wanted to learn about, different specialties. And of course, this happened and we all came around it. I understand how hard it was for us to navigate the waters of even folks like myself who were already trained on understanding how to deal with cancer and how powerless sometimes we were because we didn't have the understanding, resources, help. So that really put the seed in my mind, okay, I want to be an oncologist. I want to help something in research, and I also want to expand it and help folks beyond myself. So that's just one of those powers, right? Don't forget the power of serendipity. So this is like, what is this craziness, right? So Latin American Idol, and there's like, this is me singing, and the other one on the left-hand side here is Steve Gore, who was the director of leukemia service at Hopkins at the time and MDS, and then he moved to NIH. So, and then what is this paper? So when I was so my friend Carlos, the one who is a pathologist at Brigham, he liked to sing when we were in the university. So he took me one day to his singing classes. I liked it. I joined his group. Then he said one day, I'm going to go to Latin American Idol. And I was like, okay. So he went there, made a line. I went with him, and actually I joined the competition and made it significantly ahead, to the point that I was on TV. Just leave it like that, no more than that. But after that, when I moved to the US, I wanted to keep singing, so I joined the Handel Choir of Baltimore. And one of those members, as I was a tenor, one of the basses was Steve Gore. I was working at Hopkins and said, oh, where are you? Are you a physician too? Yes, I'm a resident. Oh, let's talk about what you like to do. And I talk about what was going on with my brother and whatnot. And then my first paper was the first phase clinical trial that I reported was in hematological because of that serendipity, right? So never underestimate the opportunities that can come by going outside the box. That's what I'm just trying to say here. So why change careers and just be in these videos and spending all this time and efforts? Well, I saw that there were a couple of things that I wanted to harness at the time. First is the imposter syndrome. You may always think, is it worth it? Do I have the skill set? Should I actually even try to get out of my comfort zone for this job or for these things? So as an oncologist, and I think there's many other folks here, but I think personally, there's a lot of skills that we have found that actually are relevant for any field outside of oncology itself. So no, with the agility, we're able to think, things very quickly. We are resilient, we're professional, we have spent a lot of our lives studying. We have strong work ethics, we meet deadlines, we have great communication skills, most of us, I guess. And even academics are not aware of it, our daily job trains us to be there. So any other, startup, anything that we do is going to have those basic cores, like assets and skills, so we can always harness them. What things are challenges are, first, the imposter syndrome. I will never be able to do this. This is too much for me. There's no way. We're very confident on just coming, to the office, and it's a very, comfy feeling, and that's fine. Also, we have a very established hierarchical system of rewards. So what is the typical reward for academia? Oh, congratulations, you did it, you got promoted, your press gaining scores are amazing, you have some papers, you actually was an ASCO talking in front of everyone, congratulations. That's great. But that's not the only, potential opportunity you have there, but that became kind of the standard. If you don't make it to the podium of ASCO, many of us in academia feel that we're actually failures. And we're just fighting for that. It's like we need to get there, because if not, then my friends who are equally as smart and accomplished as myself, and we're helping the same patients, don't feel that we have accomplished much, even though we're doing exactly the same work they do, just like we're given one opportunity to run one trial that actually to be positive, right? So all that is something that, the power of self-confidence. So let me tell you, you know how a clinic works, you know the patient's journeys, you know how they experience healthcare, you know the science, you know the space, the landscape. You can write, you can give presentations, you are ready. It's just that. So just to give you that piece of confidence. The other is the power of self-appraisal and valuation. So it's not, funding. I mean, of course, as part of the startup funder, I have to go and talk to VC funds and foundations and private equity sharks, and I feel myself by being in Shark Tank almost every single day giving pitches about the company. That's fine. However, this is a value that I think is much more important, which is our own value, right? So the ability to assess the real rewards that come in front of us. So we are used to be saying, seniority and experience are the most important things. That's key. For mentorship, absolutely. I love my mentor to be experienced, to be senior, to be there, know it all. But for us to think that, that just because of that, we're not as good as that individual, at least value-wise, is different. So we're like, oh, I will never be able to go into the startup because I'm going to be paid less. That, there's so many people are smarter than myself. So kind of this imposter syndrome situation once again. So learn from biotech and from health tech. The burnout is real. We want to overcome this by simply understanding that any additional task that you do, it comes with a price. And the price, it has to be either time off or, or money. So all that has to come together. So the rest of the world, they couldn't care less about academic rankings or accolades or awards. They just want us to be, deliverables in front of them, right? Effective communicators. We can be honest, hardworking. That's all they care about. So don't be the hero if there's no person to be saved. If the only thing to be saved is, like the office or something like that, that doesn't make sense. It has to be yourself. It has to be a person. It has to be someone you can be a hero for, right? So, and the power of opportunity. So why did I make that change? So most ideas that have been thought about, they have already been thought by someone else. Don't think that this is, oh, I'm so smart, I got this idea. Someone thought it before, but the timing wasn't right. So it's like this fisherman waiting for the fish. The one who gets, more patient, waits longer, they're going to be able to probably get it. So it's a timing of execution. It's a timing of having all the tools together and harness what we call the network effects to keep you patient and able to be afloat. So for me, it was time to find this ikigai moment, and I'll tell you exactly what ikigai means if you're not familiar with the concept at the end of the presentation. So what was the opportunity when that happened? So I was already 5 years into my faculty role at Penn. I was happy, successful, big practice, all these things. But there was a change in the way that patients were treated. So we changed from the phenotype to the genotype, so new opportunities for genomics. All these new technologies have emerged in terms of testing, which in the past people have not been able to understand or even use, and now became cheap. So we have NGS, FISH, biomarkers, so that was a real opportunity. Then came the drugs that were available. Plenty of medications. This is just last year's approvals in cancer. So just to give you that perspective, and every year there's more and more. So more knowledge, more drugs, more trials, more therapeutics coming in. So this is CAR T-cell, next generation CAR T, such as supercars. We have CRISPR technologies coming together. All of them are going to change the way we treat cancer in the future. And we have seen it now. It's a trend. Oncology trials now have reached historically highs in terms of research endeavors. And those are across all indications, but a lot of focus in rare cancer indications. That means they're rare patients to find. And also, designs are changing. So we used to have the typical designs for clinical trials, but now we're seeing more and more, particularly in oncology, that they have different designs that are put together. So that developed the just-in-time approaches, the decentralized clinical trials. When we can combine them all together, it becomes really this rich, primordial soup that can help us to change things. But the worst part is the patients are not getting much benefit from it beyond what we see in Center News. So the supply and demand are completely mismatched in oncology for cancer clinical trials. 60% of cancer trials do not meet enrollment targets. So it took Pfizer 3 years to find 50 lung cancer patients for one rare aberration. They're spending billions of dollars every year, and that goes nowhere, and the patient doesn't get benefit because of a lack of communication between the biotech industry and the patient. An engine needs to come together with all these technologies coming at the same place. And not even to add to insult to the injury, there's underrepresentation. So look at the United States. Look at the proportion of patients who are Hispanic like myself, 1% on clinical trials. And we represent 16%, right? So where are those patients? They just don't know. They don't know what they don't know, right? So with all this in together, lastly, you say, okay, let's just put it on the physicians because we care so much about the patients. Yes, we are burnout. I think there's a session on burnout too for this particular day. We know that we're one of the top burnout physicians across all the different specialties. And a study in 2014 showed that for each additional hour per week that we spend just doing clicks on one EMR, whichever you want to choose from, we actually get a 5% increase in burnout among private practice compared to 3.5 amongst community oncologists. And so when we combine all this together and knowing that research is not done mostly in academic centers only, which is 15% of the whole market, there's a big opportunity. So that's when Massive Bio came up. We wanted to come together and bring this, like Massive Bio plus a site plus CRO plus sponsors all working together, leveraging technology. So what do? We find, I mean, this is kind of, like all phrase, but right patient, right time, right location, that's fine, but how do we do it? We do it with technology. So we started doing initially virtual tumor boards, trying to discern all the genomic alterations that happened. That was 7 years ago. Then we realized that we were really good at matching patients to clinical trials, like really crazy good, to the point that instead of doing 3%, we went doing like 12.5% for all comers, even without selection. They just came to our platform and we matched into studies. So let's say, let's infuse more AI, spin it out, we call it Synergy AI, and infuse deep learning into it. And that became the Synergy AI clinical trial finder, and is free for patients and physicians to upload anytime. So this is my only pitch here for the company, I guess. But you can access any trial for free. We're just helping every single patient so we can get enough data that can help us to really produce the outcomes that we're looking for. So we have all these different analytics that we're working together, but the results are here. So we're able to match in 6,400 trials just in the US in 67 seconds. That has improved already. This is just analytics at the time. We get enrollment end-to-end from the patient coming in with the records to enrollment in 3 days. And not only that, but we go from 3 to 12.5% total, and we have all this data to back it up. So with that, we started to call different stakeholders, and we're able to bring them together, which is unique. So we brought, for example, Roche Genentech, Science 37 Foundation Medicine, and say, let's work together, do a decentralized clinical trial, and that's what is happening in the space right now and changing that. But not only that, we call the NCI, we won an RFP, so we're able to actually get out of a comfort zone, get this solution into a National Cancer Institute, and now we're going around the country, and we're just talking to some folks here who may be interested in that too later. So the idea is to do power sharing and collaboration. So what are the powers that I develop after all this craziness, right? So I have 2 minutes left, so I will be as succinct as possible. So the power of open networks and collaboration. If you know someone who is doing something interesting, don't be afraid to talk to him. Just in this picture, I have Arturo Loaiza from UCSF Pediatrics, one of the top experts in AI and data analytics, and Ariel Lefkowski, the founder of Groupon and Tempus, who is using analytics to help patients fight clinical trials. They were in the same room. We had an amazing conversation, got great insights and potential opportunities to work together. So don't be afraid of it. So people say, oh, I don't want any conflict of interest. Well, conflict of interest, it's an interesting word, but doesn't mean lack of knowledge, right? So you need to be in front of people. They need to know who you are. And most of the collaborations that have happened in the history of humanity have coming from private and public sector coming together and people really making it work. So just find a way to make it work, because it's really going to make a difference in the way things we do. The power of universal awareness and legacy is getting kind of like crazy here. So this is the Webb telescope here. So it tells us, yes, cancer care gives us a unique perspective, because that means that we no longer are concerned about petty stuff. We have to think through, like, in the context of reality, things that are really relevant. So for any decisions, look into this. If you were in your deathbed, all things considered, would you regret making that decision or not making it? And lastly, live your day today as if it's just last day of your life. That probably will change the way you treat people, the way you talk to people, the way you perform, because that's the legacy that you're going to leave to the people in the future. The only real legacy you leave behind is not money, is not names, is not the random name on the conference room in a chair because you were so amazing, is the memories that others have of you. So think how you want to be remembered in this world. And that's something that most entrepreneurs I've talked to have the same way of thinking. The power of innovative and problem solving. So this is Marie Curie amongst many other scientists, but she was a woman and she still, in that very crazy world, she actually was able to come through because she had the skills and the ability to be communicating with them without fear of, I don't have the knowledge. She had the knowledge. She removed herself from all those barriers and was able to make a difference in the life of many in cancer and beyond. So there will always going to be one or two people who are smarter than you. And that's great. You should talk to them, right? Sometimes my friend Mauricio in neuroscience always says, I'd rather have a friend who has a boat than me owning a boat. Why do I want to have that? It's too much pain. I just enjoy that, right? So same process here. So whoever is, like being a polymath is great, but just the best way to do it is just find someone who knows about that topic and work together. And if someone is a critic of you, you just talk to them, invite them to the table and say, okay, tell me how you do it better than me. Tell me, I'll do it. If you actually can do it better, that's fine. So the power of time and mind control, which I'm not accomplishing on this meeting. So, time is the most important possession that we have and cannot be bought. This is really, really the real currency in life. So take your mental health seriously. Take your time seriously. So once again, as I mentioned here, no one's going to remember that honorary plaque on the conference room because you went the extra mile. But you will be remembered by your loved ones because you took on that vacation to Sedona, right? So meet deadlines, but manage them. Do you really have to work on Christmas Eve or Thanksgiving or Yom Kippur? No, you don't. Like, is your chief doing it? No. So why are you doing it? Like, what are you trying to prove here? You already proved yourself to be effective, so you don't have to, doing these sacrificial things for no reason. Just, did it affect your well-being? Of course. So don't do it. Align meetings, cancel meetings, delegate meetings. You don't have to be in front of the table all the time. Family time, rest time, guilty, I don't sleep as much. Exercise as much as often, so I'm planning to do that. So I bought a house gym and I'm just doing that and listening to my podcast and all that stuff when I'm doing it at the same time while my daughter is running around. The power of grit and gratitude, which is what we talk about in this lecture. So give folks the chance to shine and prove themselves. You don't have to be the one at the podium or the superhero every single day, right? Without those people, I will not be here. I will not be talking about MSEd Bio or my career or anything I have done. It was people who gave me the chance. Someone who came from Colombia, who was international medical graduate, non-Ivy League trained, who just was eager to learn and thrive and prove himself to be worth of this wonderful country. And I did it as much as I could. Hopefully I can keep doing it. So just give that, pay it forward. Give that person a chance because there's really an opportunity for everyone there. There's always going to be problems and issues. That's a matter of life. So don't overthink it. Just focus on the big picture. You have food on your table, you have your career, you have your family, and time, right? If you had time to try it again, that's the most important asset that you may have. And for those who don't believe in your success, prove them wrong. Be thankful, see the big picture. You're fine. You can keep trying. So power of family and partners, so that's key. So take that trip. So I see there's Natalia in Italy. So make great memories with all of them. Take the trips, tell them often, tell them you love them, check the pulse all the time, and apply all the other superpowers to the family because that's the key for you. So MSEd Bio is, of course, part of my family now, so now I spend a lot of time with them because we're trying to change the way oncology is being transformed for clinical trials, and hopefully we can all join us. There's a few leadership pearls that I love to share because they're not mine, there's other people's ideas, but people, quit bosses and not jobs, right? Always remember that. Scientific acumen or fundraising do not make you a good leader. Spend time with people, learn who they are, learn what they're doing, and understand them where they're coming from. That's going to help you a lot. The best way to learn from, for improvement is from other people's mistakes. Don't commit them yourself. learn, pay attention, read the room, talk to people. That's going to tell you a lot and save you a lot of pain. Antonio Garcia Marquez from the ex-Facebook, he said, a startup is like jumping down a cliff and building the plane as you fall. Plan accordingly. I can absolutely empathize with that 100%. Colin Powell, hire for strength, not for lack of weakness. Ben Horowitz said, there are always a few silver bullets. Apply a lot of lead bullets. It means that you have opportunities to aim for perfection, but you're never going to be ready to go. Just try and improve on the way to go. For meetings, Jeff Bezos says, unless this is an all-hands meeting, the amount of people who should be on a table is the amount of people who can share a pizza. That makes them very successful. And this is one of mine. When possible, work with people who you enjoy working with, right? So if that person is going to give you the bad energy and is going to take away the energy from your crystals, don't have them over at the table, right? So that's something that I wanted to make sure that we have that. We can be collaborative, but we have to learn, who to work with accordingly. So as a biotech startup, you have to multitask, be flexible, eager to learn, be entrepreneurial. There's all these problem-solving skills that you can read later. I guess you can download my presentation later. But this is the final point I wanted to make about Ikigai. So what is this? Ikigai is a Japanese concept. I love Japanese. Keep trying to learn it. I started learning it like many years ago. Now I just watch anime just to keep myself praised to that. But the Ikigai is a concept of life where you find the balance of all the things that you want to do. So first is things that you love, what you love in life as a whole. Things you're good at, things you can be paid for, and things that the world really needs. So if you look at yourself in every single one of that Venn diagrams, you had to find that job that, first of all, you're good at. So maybe I'm good at oncology, I guess. Can I be paid for this? Yes. The world needs oncologists or innovators in healthcare, hopefully. And do I love to do it? Every single day. So in my perspective, I found that. Look for that. There's no perfection, but at least something that covers most of these angles. Once you find it, you're going to be the most successful in whatever you do. And with that, I finish my presentation. Thank you so much.
There isn't really a universal database for oncologists and advanced practice and navigators to look at when they have a patient sitting in front of them. And the drugs are coming out exponentially and changing. And why, after all these years, there hasn't been something like that developed? You have Clinical Trial Finder, but we're never going to get patients to clinical trials if we're not doing complete genomic profiling and finding them.
That's exactly right, and that's one of the things that we are doing as a company. So we know that under-genotyping is extremely high. It's about 88% of patients with advanced cancers do not get ever tested for NGS. And this is data from other vendors and folks, but actually our own data reflects exactly the same pattern. So what we want is collaboration. So what we're trying to do now, and we've been doing for at least a couple of years now, is trying to connect the dots, being very patient-centric. We can potentially improve this. If the patient meets, medical necessity, what we call for reimbursement, and the patient has a diagnosis of cancer in an advanced setting, they should be able to get tested at some point in their lifetime, right? So that's what we're trying to strive for. So the idea is to use technology and validation so folks who are paying for it, which is the payers, right, they understand the value. But we also need the clinicians, such as yourself and myself, to be believers in these technologies, right? What we see in the community is that there is a significant clinical lack of awareness of the utilization of this. But mostly it's because they feel sometimes, this is something we've been looking internally, is, well, is because they may lose the patient to a big shot academic center, or they may not be able to get the drug, or it's too much pain, or I don't know how to manage the side effects. So we need to be very, very patient-centric, give the patient the education, and use that opportunity to get that patient tested on the spot. So that's what we're trying to do now. And happy to discuss further, but this is something I'm really working personally on that. Actually, I had three calls yesterday with key stakeholders, Carries Foundation, NeoGenomics, and Garden is part of those ones I'm talking to now. So.
Arturo, thank you very much. And thank you for asking that question as well. So I've been a medical oncologist for over 32 years now. And I'm a thoracic oncologist, lung cancer person, Rafi Salgia, hi. And we painfully appreciate exactly what you said. What about all this next generation sequencing, the genomics, the genetics? So hopefully I can send a website to Sarah and to Dalen. They can distribute it to everyone. We just developed an app for patients for lung cancer where you can go on it and say, what is the molecular testing and what does it mean at the same time, and what are the potential trials? So let's say if you have an exon 19 deletion in EGFR, where would one go to? But even if you hadn't had the next generation sequencing, how to think about those issues. So we all need to, and Arturo and I were just talking outside as well, we as institutions need to get together and develop that platform, and we're very much supportive of that.